So those agents which are currently have been investigational status in phase 2 or phase 3. We have the oral agents, the small molecule Janus kinase inhibitors or JAK inhibitors, and these are working at the intracellular level because those JAK pathways really lie at inside the cell as the downstream signaling cascades for so many of these different cytokine pathways that have been shown to be at least implicated or important in atopic dermatitis. And we have a variety of different agents. The ones that are farthest along right now for the systemic development in atopic dermatitis would be baricitinib, upadacitinib, and PF 049-65842. These are oral agents right now being studied for atopic dermatitis. Tofacitinib had some data for mild to moderate atopic dermatitis in some case series, but I don't believe is being developed commercially for atopic dermatitis. And then we have topical delgocitinib, which is being studied now for atopic dermatitis as well. When we look at the specific cytokine targets, we have 2 agents that are being studied right now for targeting interleukin-13 by itself, and those are lebrikizumab and tralokinumab. Each binds slightly differently in terms of how it blocks the interleukin-13. We also have interleukin-17 blockers that have been studied. These should sound familiar to those of you who are familiar with the psoriasis story, and some have questioned whether or not these may or may not be effective also in atopic dermatitis. We have also interleukin-31 receptor alpha blocker known as nemolizumab, which blocks the receptor for interleukin-31, which is thought to be the itch cytokine, but also has certain pro-inflammatory effects. And then there's fezikinumab, which is being studied or was studied as a blocker for interleukin-22 for atopic dermatitis, although it's not clear if that will go forward beyond those past studies. And then we have a variety of other pathways as well. The neurokinin-1 receptor antagonists have been studied for really as treatments for adjunctively for itch in atopic dermatitis and are an attractive pathway. You mentioned earlier the anti-IgE blockers that have been studied, omalizumab, which has been examined, both in phase 3 studies and in real world, not shown to be very effective, and then also ligolizumab, which has been studied very well as well in phase 2.